Hello and welcome to May edition of the IMV Imaging Journal Club. My name is Bethany. I am the in-house radiographer here at IMV Imaging, and the paper I will be discussing this month is for a retrospective study on the dimensions of normal feline kidneys using computed tomography. So, whether you have joined us before or if this is your first time attending an IMV Imaging Journal Club presentation, I will just recap on how it works. This presentation should last between 30 and 40 minutes and will be available on demand for the whole of May. And you will get a CPD certificate at the end of the presentation. If you do have any questions, queries, or Journal Club recommendations, then please get in touch. We always love to hear from you. So as I said, this month's paper is looking at the dimensions of the normal feline kidneys using computed tomography. So just as a brief introduction, the kidneys are responsible for several important processes within the body. Their main job is to filter out waste products from the bloodstream and help maintain electrolyte balance and produce hormones that control blood pressure and red cell production. Kidney disease is very common in the feline population due to their diet because they are obligate carnivores. Their diet contains a large amount of protein, and removing the waste products of the protein digestion over time is hard work for the kidneys and can cause degeneration. Although the exact cause of chronic kidney disease, known as CKD, is not known, we can identify factors that can cause CKD, such as tumours, damage post-infection, inflammation of the glomeruli, toxic damage, inherited diseases, excessive protein loss. The signs of kidney disease within cats can be increased thirst, excreting more urine, reduced appetite, vomiting, coat changes, and weight loss. Kidney disease in cats, although the cat might not display any of the signs and symptoms, there are non-specific for CKD. Normally, bloods will be performed, specifically urea, creatinine, phosphate, and electrolyte imbalances. Unfortunately, the kidneys need to have more than 66% damage for these tests to show abnormal working kidneys. A urine sample is also beneficial. Diagnostic imaging is a valuable tool for assessing kidney damage, which can typically be ultrasound or computed tomography. Computed tomography is better for assessment of size, structure, and function of the kidneys, especially if an IV contrast is used. Plain film can also be used, but limitations apply due to having a 2D image with structures overlying the area of interest, unless there is a large renal calculus present within the tract. Using radiography, the renal size was first assessed by comparing its length to the second lumbar vertebra by Barrett and Kellner in 1972. Ultrasound is the imaging modality of choice because it provides information about the kidney's position, size, shape, internal architecture, and hemodynamics without harming the patient with a radiation exposure. Ultrasound can help diagnose and monitor CKD and other renal pathology in cats, and it's non-invasive and doesn't use any ionizing radiation as stated in the study mentioned above. CT offers excellent tissue contrast and provides a three-dimensional information that minimizes the effects of superimposition of organs. However, the high dose of radiation should always be brought into consideration. So the aims of these studies were to firstly determine the length, width, and height of normal kidneys. Secondly, to compare their length to the length of the second lumbar vertebra and the diameter of the aorta. And thirdly, to provide the normal reference range values for the renal cortical thickness. So the method used with this study, this study is a single centre retrospective study. The clinical records and CT images of the cats with a normal renal function referred to Dick White Referrals Hospital between January 1st, 2012 and January 1st, 2020 were collected for analysis. A total of 14 cats with normal kidneys were eligible for the study. This included 10 female neutered patients and 4 males also neutered. The normal renal function was determined by normal renal serum biochemical values, normal urine specific gravity, and the absence of renal or other abdominal diseases. All the studies were conducted by the same 16-slide multi-detector row scanner. The inclusion criteria were cats that underwent a CT study, including the abdomen, to evaluate for non-renal pathology were assessed for inclusion. The assessment included cats with serum biochemical values and uric-specific gravity reflecting a normal renal function. The exclusion criteria were cats with biochemical evidence of renal disease, renal or any other abdominal pathology on CT, abnormal urine-specific gravity, and any trauma cases. The CT imaging protocol that were as followed. So all cats underwent pre-anaesthetic screening and all patients were under general anaesthetic. Each patient was positioned in sternal recumbency. All studies were taken on the same CT scanner. All studies had a pre and post-contrast study performed. The post-contrast study was performed between 30 and 40 seconds from the start of the injection, acquiring to a portal venous phase. All images were obtained in a DICOM, which is digital and communication in medicine files. Post-scanning viewing was performed on a soft tissue window, which is a window level of 40 and a window width of 400, and this was for optimum visualization of the kidneys. For assessment of the lumbar vertebrae, we used a bony window, which is a window width of 3000 and a window depth of 600, and this was for the measurements of L2 also. The post-process analysis, so they use a multiplanar reconstruction, which is MPR, in the pre-contrast studies to measure the maximum size of each renal dimension, which is the length, width, and height. The reference structure measurements were the length of the second lumbar vertebra, the diameter of the abdominal aorta, then the length of the L2 was divided by the renal length and the diameter of the aorta was used to calculate the ratios. The renal length and width were measured in the dorsal plane and the height in the transverse plane. The renal length was measured in the dorsal plane by drawing a line from the most cranial edge of the cranial pole to the most caudal edge of the caudal pole. The height was measured in the transverse plane, vertical to the short axis. The width was completed by drawing a line from the most lateral point of the renal capsule, perpendicular to the line connecting the poles of the kidney and passing through the middle of the renal pelvis. The length of L2 was measured in the dorsal plane at the mid-level of the vertebral body. The aorta measurement in the dorsal plane was taken immediately caudal to the left renal artery. All these measurements were performed 3 times at maximum dimension for each kidney. The renal cortical thickness, RCT, of each kidney was measured in the post-contrast phase for improved delineation between the renal medulla and the cortex. The RCT was measured in the dorsal plane in 3 points where the medullary pyramid was clearly delineated. The RCT measurement used a line drawn perpendicular to 2 conceivable parallel lines representing the edge of the base of the medullary pyramid and the edge of the renal capsule. 3 measurements were averaged and the mean value was recorded for each kidney. All measurements were taken by one observer without the knowledge of the patient's history. The results. So a total of 262 cats had abdominal CT during this study period. 14 cats eligible for inclusion. The mean age was 9.47 years old. The mean body weight was 4.27 kilograms. The mean length of L2 was 1.75 centimeters, and the mean diameter of the abdominal aorta was 0.39 centimeters. The right kidney, the mean length was 3.99 centimeters. The mean width was 2.76 centimeters. The mean height was 2.31 centimeters. And the left kidney, the mean length was 3.91 centimetres, the mean width was 2.79 centimetres, and the mean height was 2.44 centimetres. There was statistically significant difference in there was no statistically significant difference in the length, width, or height between the correlateral kidneys. So this study shows that measuring kidney dimensions and renal cortical thickness in CT study of cats is feasible. It also showed that there was no statistically significant difference identified in the measurements between the kidneys within the study. There are other studies published about using other modalities measuring kidney dimensions and comparing the length of L2 vertebra, such as the paper by Barrett and Kellner from 1972. Only one other published paper discussing feline renal morphological characteristics in CT was published in Thailand. The paper from Thailand disagrees with this paper, despite the techniques used for the measurements being almost identical. The only difference was the width measurement, which was obtained differently in this study. The average dimensions were lower in the feline population in Thailand, and a clear variable that could be the study's use of the cats under the age of 7 months. This also could be due to a difference between Asian cats and those here in the UK. Another difference is that this study only included neutered cats, whereas the study in Thailand also included entire cats. Other literature states that the reproductive status of the feline patient may affect the size of the kidneys, with neutered cats normally having smaller kidneys. This is the first study known that has attempted to measure the renal cortical thickness within CT. In a study in human medicine, it was shown that the RCT is more closely related to the estimated glomerular filtration rate, eGFR, compared to the kidney length. Another study on cats using ultrasound showed that the cortical thickness has a stronger linear correlation than the reciprocal of the serum creatinine concentration and the superior diagnostic performance if CKD compared to other kidney dimensions. This study concluded that the decreased renal cortical thickness is observed in cats with chronic loss of renal function, and the measurement of the cortical thickness using ultrasound could be a valuable method of evaluating CKD progression in cats. The limitations of this study were that it was a small sample size, the absence of growth anatomy to correlate the actual size of the kidneys, lack of histopathological to confirm the lack of renal disease, and the retrospective nature of the study doesn't allow for standardization of the protocols used. The study has shown that CT is a valuable tool for when assessing the feline kidneys with measurements for CKD. The renal cortical thickness measurements referenced within the study can now be used in future studies to help evaluate chronic kidney disease further. A repeat study with a bigger sample size will only add more information and more specific and sensitive measurements of the renal dimension. I really enjoyed this study, and I think it's going to help facilitate larger studies within the future. So thank you very much for joining us today. Again, if you've got any questions, please get in touch at clinical@imv-imaging.com, or please pop your question into the Q&A box. Thank you.